This is video number 2 related to the coronavirus outbreak. My name is Marcus and I am the Managing Director of CyberSwitch Technologies. We're an independent business communications engineering firm based in Atlanta, Georgia. We have relationships with over 250 vendors on a global scale to assist you with your IT needs. We are consultants, so we work with IT directors, CIOs, and CTOs of Fortune 500 companies, states, cities, professional sports teams, banks, and hotels to maximize their operational efficiency. We are often in the C-suite crafting policy, evaluating vendors, and consulting on strategic plans, and that's why I'm shooting this video. The title of this video is Week 2, Information Technology and Coronavirus. I decided to update the data that was compiled last week in an effort to track the spread of the virus in the U.S. I will be updating the U.S. confirmed cases each Sunday night. As I mentioned in the first video, there are really 7 reasons why this virus is a problem. If you want to go back, there are details on the previous video, but I'm just going to summarize here. Number 1, it's 20 times more deadly than the flu. Number 2, the incubation period is between 14 and 27 days. There's no resistance so far, although people are recovering. There's no vaccine, and it looks like it'll be 18 to 24 months before that arrives. It's very contagious. People who feel fine are testing positive with no symptoms. And then finally, there are no plans for what to do here in the United States, especially on a corporate level. So what's behind the numbers? The main narrative that's being pushed now is that the virus doesn't impact younger people in good health. Only older people that might have underlying health conditions like hypertension are going to be impacted. So let's take a closer look at that. Who's vulnerable? If I look at the total U.S. population of 331 million people, and the narrative is, hey, don't worry, only people that are in these subsets need to be concerned. I actually went behind the numbers to figure out, okay, how many people are there that are 60 and over in the United States? Well, it turns out it's 110 million people, or 1/3 of the U.S. population. If you look at other people that have underlying health conditions, I just took 2, high blood pressure and diabetes. So it turns out total U.S. population that has high blood pressure is it's almost 1/3 at 78 million people. And then diabetes is another 100 million people. So if you look behind the narrative, the translation is, hey, don't worry, only over 1/3 of the population is at risk. So that if you look beyond what's being said, that narrative is pretty ridiculous. I mean, it's a huge subsection of the population that needs to be concerned. So let's look at what has changed in the last 7 days. I'm looking at this slide. This is the website being updated by Johns Hopkins University. And just take a look at what's happened in the last 7 days. We start with a total world infection number of 86,000. Total in the U.S. was 71 cases. And 7 days later, you can see the United States especially lights up like a Christmas tree. So we go from 89 to 109,000 cases. We go to 109,575 cases, and you see in the U.S. we went from 71 to 474 cases. So you can see the U.S. now has it in about half of the states, and it's beginning to light up like a Christmas tree. You see, things have gotten significantly worse in the last week. It took China, the epicenter of the virus, about 3 months to get to 80,000 cases. At the current growth rate, we could get there here in the U.S. in less than 5 months. So get your head around that. The time to intervene and get ahead of this pathogen is passing quickly. I mean, we really need to get on top of this. Once it hits major cities, dense population centers, it's going to be very difficult to contain. if we're being honest about the true number of cases and the response, we have to begin drastic measures now. So let's take a look at the data. I started looking at the data and just wanted to see what just the raw data, just basic things, said about our response and overall preparedness. And honestly, it didn't paint a very pretty picture. So I started with 100 cases. I know we were below that last week, but I thought, okay, what happens over time if this number just doubles? So as you can see from the graph, at week 1, we get to 2 billion infections by week number 25. And so that's just kind of long term if it doubles. And that's barring any increase or decrease in the rate of infection, just a standard doubling. So if I look at what happens over 13 weeks, we get to 582 million here. And again, this is just a US number, doubling from 100. It wasn't until I looked at it at the granular level that I really started to become concerned. Again, we started out with 71 cases here in the US. And in less than a week, we went from 71 to 474. And so what this tells you is that between weeks 1 and 6, if we double, by week 6 we'll have almost 4,500 cases here in the US. And that means that we're well on our way towards that 2 billion number. Now, here's what concerned me the most, is that in week 2, we're already above the line. Okay, and what's even more concerning is that in the hour that I've been preparing to shoot this video, the number in the U.S. has gone from 437 to 474. So it's jumped by almost 40 in 1 hour. But apparently this has been contained. That's what people are saying. So I'm not really sure that I believe that. So all those prepper shows, they don't seem so crazy at the moment. Here's what happened in the past week. There are just 4 things that have occurred in the past week. Number 1, a medical worker at Dartmouth Hitchcock Medical Center in New Hampshire, under recommended quarantine, went out to a party and may have infected a large number of people in attendance. When you're under recommended quarantine, that means you're supposed to keep your butt at home, right? But, this guy, he goes out and infects a huge number of people. And this is a medical worker. You should know better, I think. It's crazy. Number 2, an attorney in New York has infected 28 friends and family. I'm sure that was not his intention, but this gives you an idea of how infectious this is. Number 3, a cruise ship off the coast of California with thousands of people on it had over 20 positive coronavirus results. So that just tells you that number, because it's off the coast, that number 474 is probably a little bit higher. Once they start rescuing these people and taking them to the intensive care facilities, that number is going to jump. Then number 4, a New Jersey man that attended a CPAC event tested positive for coronavirus. And both Trump and Pence were in attendance. So I'm not really sure that that's supposed to happen anyway. I thought that we were supposed to keep those two separate so that, nothing tragic happens to both of them. But they need to get that situation straightened out so, we don't have something catastrophic happen like that. But, you can't make this stuff up. The mistakes that are being made here right out of a B movie script. It's like the commercial that has run recently where the college kids, they run into the cemetery to get away from the homicidal maniac instead of jumping into the running car. This is crazy. The truth is that we are above the line, so the spread is intensifying. The intervention methods do not seem to be working. We will continue to track the spread using available data. And again, I'm getting this directly off the site that's updated by Johns Hopkins University. What I would do as individuals, contact your local officials and let them know that you're dissatisfied with how things are going. And above all, you've got to follow the rules below and be vigilant. So number 1, wash your hands. If this does anything, if we survive this, hopefully it'll get people to start washing their hands a lot. I can't tell you how many times I go in the restroom and, guys are, doing their business and walking right out without washing their hands. Wash your hands, please. Number 2, cough into your elbow to prevent the spread of your germs. Number 3, self-quarantine. If you don't feel well, stay at home and isolate yourself. If you got a family, stay in the basement. Don't sleep with your partner. Quarantine yourself until you start feeling well. Number 4, get tested. I know that this is a challenge because there aren't enough tests at the moment, but again, sequester yourself and contact the appropriate officials. Don't run to the emergency room or run to the clinic. Let people know that you feel like you might be at risk, and hopefully we'll get the testing mechanisms in place so that you can get tested. Number 5, avoid large crowds and gatherings. Just don't be a part of it until we get this under control. Number 6, telework. Most companies have internet access and access to the things that you need to do online. IT managers and HR directors, you guys need to be at the forefront of this. Don't just allow people to telework. Make them telework until we get a handle on this. And then last, don't go out unless you absolutely have to. There's a lot of things you can do. You can stay at home. You don't have to go shopping right now. You can even get your groceries delivered straight to your car. But if you don't have to get out there and expose yourself, don't. We are at stage 4. If you don't know what stage that is, please watch the previous video. Again, we were at stage 4 after only 1 week. So that's a bit concerning. At the management level of your companies, to put into practice your PIDO plan. PIDO is Pandemic Information Technology Optimization Plan. Reach out to us if you need help with your PIDO plan or any of these technologies. We deal with over 250 vendors on a global footprint that provide these technologies. So if you need help, reach out to us at info@cyberswitchtech.com. You can book a meeting directly from the website, cyberswitchtech.com, or you can call us at 678-235-9076. In terms of the assistance that we can provide, we provide access to sanitization companies, telework companies, online education companies. There's software that makes all this very, very simple and straightforward. Carrier services, which provide fast and reliable connections for all your staff. Unified Comms, which is your communications links and teamwork software. Cybersecurity, which keeps your networking secure, both in the office and at home. Surveillance, there's video and thermal scan surveillance technology, which can protect your corporate headquarters, and then drones, having to do with the delivery of supplies. So if you need assistance with any of these technologies, we are experts in all things IT, which means you don't have to be. Give one of our experts a call and let us help you to manage the task at hand. I've attached several links that are sources for all the items that I've discussed. Thank you for your time. Please click the like button and subscribe for other IT related content.